It's Dr. Osborne on the Pig Dr. Osborne Brain Show. And actually today, it's a little bit different. It's going to be the Pick Kresser's Brain Show. Chris is a genius of functional medicine. He really is. He's done a lot of great work. Those of you who don't follow him, he's founded the Kresser Institute. He's got one of the best functional medicine clinics in the country, if not in the world. And he's what I would call a functional medicine nerd. He really knows the research. He really applies that in his clinic on a regular basis. And I'm super excited to have him here. And he's got a new book coming out called Unconventional Medicine, which I think I've got my copy right here, my early copy. And I'm super excited because he's talking about a lot of concepts that I think are going to be very helpful for you all to hear today. So thanks, Chris, for being with us today. It's super great to have you.
Peter, it's a pleasure to be with you again. Thanks for having me on.
Yeah, you're welcome. You're welcome. So let's talk about unconventional medicine, right? One of the things you talk about in chapter 1 is what's the word? You used it. It's from Band-Aids to healing. Yeah. I think let's talk a little bit about what that means, because I mean a lot of the listeners, they know that symptom treatment is not the right answer, but you've got a much more in-depth answer, and I'd love to get your take.
Yeah, sure. So, let's start with what conventional medicine does right. If I get hit by a bus, I want to go to the hospital. It's pretty amazing for emergency, trauma, injuries, acute infection. And that's because those were all the major challenges that we faced when conventional medicine evolved. Like back in 1900, the top 3 causes of death were all acute infectious disease: typhoid, tuberculosis, and pneumonia. And conventional medicine really does excel at dealing with those kinds of problems. It's pretty amazing in that regard. But today, the healthcare landscape is totally different. 7 of the top 10 causes of death are chronic disease, not acute problems. And 86% of the healthcare dollars that we spend go toward treating chronic disease. So the biggest issue is that our medical model is not really set up to handle the biggest challenge that we face today, which is chronic disease. And, the focus on just managing disease after it's already occurred or suppressing symptoms with drugs has really failed us. And this is evident by the growing rates of chronic disease. 1 in 2 Americans now with chronic disease and 1 in 4 with multiple chronic diseases. So my book is basically a call to action. I'm hoping to raise awareness about this and to advocate for a better model that is really more based on addressing the root cause of disease so we can prevent it and reverse it instead of just playing whack-a-mole with the symptoms. And I think we have to do it because it's not just individual health that's at stake. It's really actually even the survival of humans as a species and the survival of our country as a nation. By the year 2040, some estimates suggest that we'll be totally bankrupt if healthcare expenditures continue to rise at their current pace. So this is kind of like, I call it a slow motion plague in the book because it's every bit as serious as something like the bubonic plague. It's just unfolding on a longer time scale.
Yeah, I love that analogy, the plague, a modern day plague. Can you talk a little bit about, in your clinic, what are some of the solutions that you offer? I mean, obviously, I know you educate your patients and you empower your patients in a more meaningful way. And I like what you said. You kind of pre-said that, look, if you get hit by a bus, go to the hospital. We don't want to take your emergency case because there's a good place for you to go, and we have a great system for that. But kind of walk us through functional medicine in a nutshell, or I know you take it by a different name and a little bit different of approach, but I think I'd like to hear your take on that as well.
Sure. Yeah. So, we recognize that the starting place, as I know you do, Peter, for everybody is diet, lifestyle, and behavior. If we understand that 85% of all disease is caused by environmental factors, not genetics, not acute problems, but actually just the way that we eat, the way we sleep, the way we exercise or don't, how we manage our stress, all of these things, which of course everybody has heard a lot about. It's not a news flash, but the difference between knowing about that and actually taking meaningful action is a a wide gap for many Americans, right? So in our clinic, we use that as the starting place. And part of what we do that might be a bit different is, we have health coaches and nutritionists that are available to work intensively with patients on those areas, because I've learned over many years, and also from looking at the research, that information is not enough to support behavior change. And we've all probably had the experience of this in some area of our life where we know what we should be doing, but we don't actually do that. And, it's just human nature. And so the problem is, if I just tell a patient, hey, you should go on a nutrient dense, whole foods diet, they say, yeah, you're right. And then they go home and they don't do it. It's not because they don't know that it's the right thing to do, or even because they don't want to, or even because they're not motivated to do it. It's because they need more support. And we have these hardwired mechanisms in our brain that fight those changes. So, we work really intensively with patients on making these important behavior and lifestyle changes. So that's one thing. The other is that, we really do embrace this idea of addressing the underlying cause. So we don't focus as much on the symptoms that the patient is experiencing, except insofar as they inform us about what the cause might be. The symptoms are a kind of conduit or a piece of information that might help us determine what the cause is. But we use a lot of functional lab testing, and also conventional, blood chemistry panels and standard tests to try to figure out the cause of the problem, and then address that so the patient can get well and stay well without unnecessary drugs and surgery. And most of the people that come to see us are coming for that reason.
I've got a bunch of questions coming in. I want to kind of give you the ability to answer some of them in Chris Kresser style. Debbie Boone is asking, what's the best for severe allergies year round? Debbie, I'm just going to assume, and I'm going to interject, I'm going to assume that you mean external, not food allergies, but seasonal outside allergies. What do you think, Chris?
Yeah. So allergies, of course, are a form of immune dysregulation. We should be able to live in harmony with our environment, both our internal environment and our external environment. And when you have a situation where the body is hyper reactive to things that are just a normal part of our environment, then that is a sign of the immune system being dysregulated. And that might sound obvious, but it actually is really important because, in the typical approach to allergies would involve antihistamines and things that just, suppress the symptom, which is the histamine production that happens in that allergic response. But in the functional medicine approach, there's not actually an easy way to answer that question, because for one person, the thing that's dysregulating their immune system might be a leaky gut, which I know you talk a lot about, Peter. For somebody else, it might be a food intolerance. For somebody else, it might be mercury toxicity. For somebody else, it might be a disrupted gut microbiome. So it's really hard to answer those kinds of questions in functional medicine, because one of the principles of this approach is that we treat the patient, not the disease. And in many cases, you'll see different causes for the same disease amongst different patients. Now, having said all of that, I would say that the number one cause of allergies in my practice, from what I've seen, is a disrupted gut. So whether we're talking about SIBO or bacteria or disrupted gut microbiome or fungal overgrowth or undetected parasite infections or food intolerances like gluten or soy or dairy, that's usually the starting place for our investigation.
So on that note, I'm going to follow up question to that. I know you do functional testing, but let's just say, okay, across the board in your experience, what is the most common thing that you find consistently across the board with the majority of people?
Yeah, I would come back to the gut again. I mean, we run gut testing on every patient that walks through the door. And the reason we do that is even if someone has a complaint that's not obviously related to the gut, let's say it's a man who has high cholesterol, or let's say it's a woman with psoriasis or eczema, or let's say it's a kid with a behavioral disorder, we know from the research and also from clinical experience that the gut can be a primary driver for all of those problems, even though they're, again, not obviously related to the gut. So we test everybody for SIBO. We test everybody's gut microbiome. We test for parasites, fungal overgrowth, all the things that I mentioned before. And I would say it's actually quite rare to find a patient that doesn't have at least something going on in that, in the gut. And the reason for that is that we have a modern diet and lifestyle that is absolutely perilous for gut health. Starting with C-section births, which have become much more common, to not being breastfed, to heavy antibiotic use during childhood, which is more and more common, to a diet that's high in processed and refined foods. I had many of those things that I just mentioned as a kid myself, and that unfortunately just sets us up for gut problems further down the line. So I would say that's the most common thing that we see.
So the old adage, all disease ends and begins in the gut, is what you see as well. I have to resonate that exactly.
Yeah.
Let's see here. I want you to answer this question because this is a very hot topic right now. What's your take on CBD oil?
Yeah. I think cannabinoids are really exciting as a potential treatment of all kinds of different conditions. CBD being cannabidiol, one of the cannabinoids that's not psychoactive, which of course makes it easier to use in clinical practice because you don't have to worry about the psychoactive properties. It's legal in all 50 states, which, of course makes it easier to use as well if you're a clinician. And I think it has some pretty important properties. It's anti-inflammatory. So it's been shown to be beneficial in things like inflammatory bowel disease, Crohn's and ulcerative colitis, also in rheumatological disorders like rheumatoid arthritis, and just, osteoarthritis and joint pain. It has a relaxing effect on the nervous system in many cases. So it can be helpful for people who are having trouble with sleep, which is almost every patient I think now that I have in my practice. It can be useful for anxiety for that reason as well. It has a really strong antimicrobial effect as well. And so patients have had success using it for skin disorders that are either bacterial or fungal in origin. I've seen patients have pretty remarkable results with eczema, psoriasis, dermatitis, different types of skin problems by actually just applying it topically on the skin. So I think it has a big role to play, and I would like to see more research on it. That's been obviously the biggest limitation because it's still, not CBD, but cannabis itself is classified still as a Schedule I substance, which is worse than heroin or cocaine in the FDA's opinion. So there hasn't been much research, but the research we have is very encouraging. And I think the last thing I'd say about it is that it has the potential to help populations that really are poorly served by a conventional medical establishment. So I saw a program last night, actually, it was talking about PTSD in veterans and how helpful not only CBD, but just, combination THC and CBD products have been in some isolated studies with veterans dealing with PTSD. But the VA, Veterans Administration, won't let the doctors even talk to the patients about it because of how cannabis is classified as a Schedule I substance. And then there are kids with epilepsy is another application that I think of where CBD has been shown to be really helpful. And those kids suffer so much, and the drugs are so brutal. So anything that we can do to help them is welcome.
Yeah, good answer. Thank you. Another question coming in about your book, and Chris's new book is Unconventional Medicine. And when's that going to be out, Chris? It's
actually out now. It came out on Tuesday of this week.
So they can go to Barnes & Noble, Amazon. Where are we sending them?
Amazon. It's only available on Amazon. It's not in bookstores, but it's on Amazon and on Kindle and paperback and audiobook formats.
So that you hear it, folks, you need to go to Amazon right now and get your copy of Unconventional Medicine. What Heather's asking a question about the book. Does your book address how you were talking about behavioral shifts and how you have a lot of health coaches, nutritionists?
Yeah.
Does your book address how to make those behavior shifts?
It does talk about that a little bit, but frankly, that's probably going to be my next book that goes into more detail about that. So there's in the book, I advocate for kind of a three-pronged approach to treating chronic disease. One prong is functional medicine, which we've talked about. Another is what I call the ancestral diet and lifestyle, whole nutrient-dense foods. And then the third is what I call a collaborative practice model, which is a model that uses health coaches and nutritionists to support people in making behavior change. We do talk a little bit about the successful principles of behavior change in the book, and I also make some recommendations for other resources. But in general, I think, just to kind of summarize the approach, it's shifting away from the expert model, which is the model that many of us function in as clinicians, where we deliver advice or information to our patients and we expect the patient to just receive that and act on it, which, some patients do, but many don't. That approach, that expert model is needed, and it's very effective in some situations. But when it comes to chronic problems and behavior that require behavior and lifestyle change, this more collaborative model where the patient is working in conjunction with a health coach on, who can support them using tools like motivational interviewing or coaching to strengths or appreciative inquiry or reflective listening, asking powerful questions. All of these things are super important. And it certainly can be, you can learn about successful techniques of behavior change on your own. And there are a lot of books out there that are great for that. But there's some pretty powerful research that suggests that behavior change happens most effectively in relationship. So some examples of this, and you've probably seen these statistics too, Peter, that suggest that obesity may actually be in some ways a contagious disease. They've found that people who have friends that are obese are more likely to be obese themselves. And weight loss interventions are far more effective when they're done in a group or a community setting than they are individually. And so I think that, working with a coach, if you can find one, or someone, whether that's a clinician or a coach that's able to play that role, is a really powerful way of making successful behavior change. And it's something that we need to integrate more into our system if we want to reverse chronic disease.
I love what you just said. You are who you hang out with, in a sense. I want to chime in a little on that, because where I see a lot of struggle is in the family unit itself. Yeah. You've maybe got one family member who's very, very sick. The others, they have problems, but they're not debilitated. They don't have the level of pain that makes them want to run and get a doctor and really investigate. But they almost, in a sense, in some cases, ridicule that other family member, make fun of their gluten-free diet, make fun of the changes that they're trying to make, demean those changes. And I think we have a social acceptance of self-deprivation, a social acceptance of self-harm and of self-disrespect as it relates to diet and lifestyle in the homes. And I think a lot of the change has to come from the core unit, which is why I recommend people, if you don't have a really strong core unit at home, you've got to find a core unit in your community, people you can go hang out with, that you can associate with. I think that's one of the reasons Weight Watchers has been such a successful group. Yeah. Not that I think people go Weight Watchers as a success route and counting calories, but they have a core unit of people that support each other on a weekly basis, and there's accountability weigh-ins and there's accountability meetings.
Same with Alcoholics Anonymous. It's not the actual methodology they found that's important. It's just the support of the community. I 100% agree.
You talked earlier about bankruptcy. I want to dive into that a little bit, because I think, here we have this healthcare plan that's been passed. I don't think it's going anywhere. The reality is that what it pays for doesn't do anything. What it pays for is it pays for chronic failed medicine model. And a lot of people are out there screaming, give healthcare to everyone, but they're not giving healthcare to anyone with this system. What's your opinion on this current system, and what, in your opinion, needs to change to make it better?
Yeah. So I think the first place to start is we have to get clear that health insurance is not healthcare. This whole debate, the Affordable Care Act, ACHA, was all about health insurance. And the idea was just that health insurance is the same thing as healthcare. It's not. It's a method of paying for healthcare. That's a totally different thing. And the key message is that there is no method of paying for healthcare. I don't care if it's a government, if it's corporations, or if it's individuals, that will be adequate in the face of the rising rates of chronic disease that we're seeing right now. It's simply not sustainable economically. And I'll give just one example of this. So we know that according to the American Diabetes Association, the cost of treating just one patient with type 2 diabetes for 1 year is $14,000. So if you imagine that a patient gets diagnosed at age 40 and lives till they're 85, which is possible given our kind of heroic medical technology that can keep people alive probably longer than they would live otherwise. That's a cost of $630,000 to treat one patient over, half a lifetime with type 2 diabetes. Now, the CDC just released statistics suggesting that 100 million Americans, 1/3, have either prediabetes or diabetes. And 88% of people with prediabetes don't even know that they have it. And the average length of time it takes for someone to progress from prediabetes to full-fledged type 2 diabetes is just 5 years. So it doesn't, if you do the math, just in 5-10 years, if we don't change this trend, we could have a shocking number of Americans with diabetes. And if you multiply that number, let's say even 50 million or 25 million times 630,000, the number is so big that I don't even know what it is. It's like a Google or, something, 10 to the so many zeros after it. It's a number that is certainly bigger than all of the economies in the world. And there was a statistic that I came across that said at the current rate of growth, we'll be spending $50 trillion by the year 2050 on treating chronic disease. And that's bigger than the economies of the economies of the 6 largest countries in the world, or the 6 largest economies in the world. So it's pretty stark, actually. We're on a path toward bankruptcy, complete financial meltdown and failure. The system that we have cannot survive in its current form. And so we have a choice. We can either be proactive and do something about it now, or we can wait for it to fall apart and then be in a position where we have to respond in a kind of house is on fire type of way. And that's going to be obviously a lot more painful and a lot less effective. So that's in many ways, this is why I wrote the book now.
Yeah. I think to me, getting this book in the hands of as many doctors and healthcare practitioners as possible is important, so that they can look at the numbers and do the math. Because a lot of them, I think, it's maybe not an ego thing, but you take the average doctor who does conventional medicine, for chronic disease, their income relies on them continuing what they're doing, their families, all of their responsibilities, their bills. These guys are in a really, really bad position and bad situation. And the quicker we can get them out of it and moving toward a functional medicine model, I think the better the world is going to be off, and the more we're going to save in the long run. So just getting them exposed to these ideas, to me, is very, very important. The quicker we can do it, the better. And
even the general public. I imagine you've had this experience too, Peter, but I often, from doctors that I train, I ask them how they found out about me. And a lot of them actually say from their patients. It was a patient that brought an article I wrote for my blog in, or mentioned me, and then they went and checked it out and they liked it. And so even if you're not a doctor or a healthcare practitioner, if you're what I call a citizen scientist or a health activist, someone who reads blogs and follows this stuff and is passionate about it, you can make a big difference just by spreading the word and being an evangelist for the cause. Because the truth is, there's a lot more of you than there are of us. There's a a relatively small number of healthcare practitioners, but there's a very large number of general public, people in the public who can actually do a lot to raise awareness and move this forward.
Yeah, absolutely. I'm going to answer a few more questions. Those of you listening, thanks for tuning in today to the show. Let us know where you're from. Chime in, say hi to Chris. Let us know where you're from in the world. We like to know. And make sure you hit that like button and that share button. We want to get this information out to as many people as we possibly can, because the more people we get it out to, the more people we're going to help. This question coming in, I think it's a great question, and love to get your take on it. What about those of us that have environmental causes, but also genetic causes for autoimmune disease, such as positive HLA-B27? Yeah. Can you comment on genetics and chronic degenerative diseases?
Sure. So, when I said environment is the biggest factor in disease, that's absolutely true. That doesn't mean that genes don't play any role, of course. And HLA-B27 is a good example of that. Celiac disease, of course, is a good example of that. MTHFR polymorphisms that increase the risk of neural tube defects. There are many examples of how genes play a role. And I actually have a very simple way of expressing this as a mathematical formula. Don't get scared or turn this off. I'm not a mathematician by any stretch. It's a very simple formula. It's genetic predisposition plus modern lifestyle equals modern disease. So an easy way to think about this is, let's say you take 100 hunter-gatherers who are living in a pristine, ancestral environment, and they're totally free of chronic disease. Then you take them and you drop them into New York City, and they're all of a sudden they're on a standard American diet. They're not sleeping. They're working a sedentary job. They adopt a modern lifestyle right away. They're going to start developing modern disease at the same rates that we all have it, but they're not all going to get the same diseases, right? Some portion of them are going to become overweight or obese and develop type diabetes and metabolic problems. Maybe another portion is going to develop autoimmune diseases. Another portion might, develop cardiovascular disease and stroke. Another group might develop arthritis, et cetera. And so they all have the same environmental exposures, but what determines which particular disease path they go down is their genes and how their genes express in relation to those environmental exposures. So that's where studying the genes, and more specifically epigenetics, as we're increasingly being able to do in the future, can help us out. But still, the important thing to understand in that example is that the diseases those genes don't express and cause disease unless you have those environmental factors. There are exceptions like cystic fibrosis, conditions where if you have the gene, you will absolutely develop the disease no matter, independent of the environmental factors, but those are in the extreme minority. Most modern chronic diseases will only be activated with the environmental factor.
Yeah, I like that you said that, because so many people are going and getting these 23andMe tests, these mass array tests. Yeah. And they're dooming themselves, like in their own minds, they're dooming themselves to some ill-begotten fate over a result that may or may not do anything for them one way or the other, good or bad.
A good example of that is, I'm sure you encounter a lot, is people who come in and talk about MTHFR as if it's a disease. I'm homozygous for MTHFR, therefore, I have a disease. And what's interesting is that when you look at Italy, for example, the Italians have a very high prevalence of MTHFR mutations, even higher than we do in the US, significantly higher, but they have a lower penetrance of disease conditions caused by that mutation, which means they don't have a lot of neural tube defects. They don't have a lot of the things that you would expect them to have based on those MTHFR mutations. So that's powerful evidence that the gene, is not the primary issue. It's the gene and how it relates to the environment that makes a difference. And, not to get too down the rabbit hole here, but The MTHFR polymorphism, what it does is it reduces the binding affinity of that enzyme to the nutritional cofactors that it needs. So, folate, B12, particularly folate in this case, it won't be able to bind as well to the receptors. But if you eat enough folate, you can just overcome that by having an abundance of folate available, and it will there'll still be enough receptors that can bind to it that you can overcome that polymorphism. So that's an example of how the gene itself doesn't tell us anything per se. It might make us pay more attention to that area, and I think they're useful in that regard, but it's not something that can't be overcome in the vast majority of cases.
So what I just heard you say in a nutshell is use the information to adjust your behavior, to accommodate any potential mutation that could put you at a disadvantage or at odds with your lifestyle. Right.
But don't look at it as a life sentence or some defect that I think, as you said, Peter, we hear a lot of people kind of identifying themselves as having something wrong. I've got this mutation, I've got that mutation. That means I'm this, that means I'm that. It's not that deterministic. And there's so much we don't even understand about it right now. So for example, you might have one mutation or polymorphism that increases the activity of a certain process in your body. But then over here, you've got this other mutation that decreases the activity of that process. And then you've got a mutation over here that increases the activity of another process that affects that process that in turn, it's just, there's a level of complexity that we're only just barely scratching the surface of. And we haven't even started talking about all of the omics. So like transcriptomics, metabolomics, this is where we look at the expression of genes and we look at the relationship of genes, genomics, all together instead of just looking at those single nucleotide polymorphisms, which is genetics. So genetics is just looking at the single genes without any consideration of how they interact. Genomics, transcriptomics, proteomics, all of these omics are looking at these big relationships, and we are just barely scratching the surface of that. It's exciting, in the future, we'll be able to apply big data and AI and, some of the new modern tools to interpret this data. But right now, our ability to collect the data so far exceeds our understanding of it and what to do with it clinically that it's, we're not even in the same room.
Yeah. And I think too, it's who's interpreting the data. Because a lot of people that are collecting the data do not have a functional medicine mindset. They have, a hammer it with a nail, treat the symptom mindset. And so they're looking for drugs that can flip off or on gene switches instead of, lifestyle choices and behavioral choices that can work with a person.
Right. Well, because who has the money to pay for the big data and the artificial intelligence? It's not you and me.
No, it's that catch-22 again. Yeah. Part 4 of your book, you talk about 4 common conditions. Can you elaborate a little on that part of the book?
Yeah. So, I wanted to give people a kind of real world example of of what the difference is between a functional and conventional medicine approach. And, I figured that one of the easiest ways to do that is by, actually showing some of the more common conditions that we see in clinical practice or that people deal with in their lives. And so one of those, of course, is high cholesterol and statin drugs. And in the conventional model, we know we all know very well what the approach is there. You go into a doctor, you have high cholesterol, and there's immediately what's going to happen is you're going to be prescribed a statin. There's not going to be any investigation into why your cholesterol is high in the first place. It's just going to be take this drug. And then if you ask the doctor, how long should I take this? You know what the answer is going to be the rest of your life, essentially. So in functional medicine, we would do it differently. We would first start with the question, why is the cholesterol high in the first place? Because that's not a normal state for humans. So we would we look at pathologies. We know that poor thyroid function, gut issues like intestinal permeability or disrupted gut microbiome, insulin or leptin resistance or other metabolic issues. There's studies showing that exposure to heavy metals like lead and mercury or infections like H. pylori can all lead to high cholesterol or high LDL particle number. So we basically go through and address all of those as we find them. And then we would measure the cholesterol again. And in many cases, you'll see that it comes down significantly, if not all the way. And in cases where addressing all of those mechanisms doesn't completely resolve the issue, then we assume that there's a genetic factor at play, and then we will tweak the diet and the lifestyle to try to adjust it. And so, medication is not only not the first line of action, it's often not even in the picture at all, because there's so many other things that we can do, to address that. So another common condition, I'll just go, mention two, is asthma. So this is the albuterol, which is the inhaler, is the third most prescribed drug in the US, actually. And the conventional narrative around asthma is basically, okay, so you have difficulty breathing, you carry around this inhaler. Whenever an attack starts up, you give a few pumps and you'll be, doing this for the rest of your life. So you better make sure that you have that with you. And it affects 25 million Americans, almost 10% of the population. So that's it for the conventional medical approach. There really isn't anything more that they offer. In functional medicine, we recognize that many aspects of the modern diet and lifestyle have contribute to asthma, like processed and refined food, food sensitivities, additives, dyes, environmental toxins, sedentary lifestyle, chronic stress, sleep deprivation, etc. So we address all of those things. We look at gut function, and it may not cure asthma in all patients, but it often significantly reduces it to the point where they no longer need to use inhalers, and they're able to live a pretty normal life. So that's an example of how it differs.
Yeah, great analogies. I will add that, just the steroid part alone can dysregulate calcium and magnesium and vitamin D.
Yeah.
It can lead to a host of contributions toward more autoimmune disease beyond the asthma itself. So, yeah. That's
the other thing is that drugs, we say drugs have side effects, right? I think that's a misnomer. The way I like to put it is drugs have intended effects and then they have unintended effects. And the unintended effects often far outnumber the intended effects, so that, like you said, you take a prednisone or a steroid, it has the intended effect of, reducing the inflammation that's in the lungs, in the airway. But then it has several unintended effects like vitamin D deficiency and global suppression of the immune system. So increased risk of infection, weight gain, increased appetite, et cetera, et cetera. And then as we all know, what often happens is if you take a drug, let's say, an SSRI for depression, and then it causes some unintended effects like constipation, and then there's another drug that you take for that, and then that causes some unintended effects, and then there's another drug that you take for that, and before you know it, we have patients that are on 5, 10, even 15 medications when they come to see us. And it's kind of it's a web that it becomes almost impossible. When someone's on that many medications, it's almost impossible to treat them because there's so many unintended effects, working against each other, that it's very difficult to see clearly what's happening.
Yeah, you get confused of the unintended consequences of the drugs, or is it the disease?
Yeah.
Or
exactly.
is it a combination or a synergism between them all, plus the patient's diet, plus their right. All of that just kind of meshes together, doesn't it?
Yeah, exactly.
Okay, let's see. We've got so many questions coming in here. Kimberly is saying, thank you for the MTHFR discussion. I'm glad you were able to point that out. I think that's such a misnomer, not a misnomer, but just misintentioned information.
Yeah. They mean well, but it's misunderstood for sure.
Misty's asking, do you test all autoimmune patients for infections such as Mycoplasma, Borrelia, Lyme, EBV, etc.? Is that something that you do on a regular basis? Not so much.
I do. So my co-director at the clinic, Dr. Sanjay Schwag, is an expert in chronic infections, particularly tick-borne illnesses, but all, reactivated viral infection, intracellular infections like Mycoplasma and Chlamydophila pneumoniae and others. So it is something that we look at quite a bit. I don't necessarily test all autoimmune patients because something I talk about in my book, I call it the functional medicine pyramid. And it's a way that I think about approaching patients with complex conditions, because we can't do everything for every patient all at once. I mean, there's almost an unlimited number of things you could look at, tests you could do. And if you try to do it all at once, number one, it'll be, exorbitantly expensive. Number two, it's just too much for the clinician or the patient to get their head around at any one given moment in time. And number three, it's not necessary, because what I've learned over time is that, 20% of issues tend to be at the root of 80% of the problems. It's that old 80-20 rule. So, we typically will start by looking at the gut. We'll look at the HPA axis, which is a system that's affected by stress and determines our stress tolerance. And then we'll look at a functional blood chemistry at things like blood sugar, thyroid, lipid metabolism, nutrient status, et cetera. And we address all that stuff. And then, in a lot of cases, the patient gets well just from that. But if they've improved but not gotten well, we go on to the next level. And that might be looking at things like heavy metal toxicity, mold, hormone imbalance. And then and then we might also look at infections in that realm. So we try to take it in a stepwise fashion like that, so we don't end up doing a lot of unnecessary testing in people that don't need it.
And then obviously, I would say that probably depending on the patient, let's say they had a history of a moldy house or a history of water damaged building or something, that you might say, no, we're going to do that too at this point, because the history speaks of the problem.
Yeah, and that's where, of course, the good old fashioned detailed intake comes into play, just listening to the patient, hearing about their story. And like you said, if you have someone who was well until they moved into an apartment where there was visible mold in the shower, and all of a sudden they got sick, we'd be crazy not to go ahead and do the mold testing right off the bat. Likewise, if someone was well and then they went to and we're in the Peace Corps in Peru, and they felt really ill and got sick and have been sick ever since they got back from there, well, you bet we're going to be testing for infections a lot earlier in that patient. But it just highlights the fact that there's no one size fits all approach, and we always have to treat the patient, again, not the disease, and not kind of follow blindly a framework that we create.
Yeah. This is a good question. Barb is asking, and I'm going to add something to this as well. How do you know when your gut is healed? And can I just have you comment on that, but then also comment on what my mind goes right to, which is perfection. People looking for perfection versus people looking for life and reality, and that there are ebbs and flows and ups and downs. Can you comment on that? Absolutely.
Something I know a lot about myself, because I've struggled with my own health issues, and that's how I got into this work in the first place. So the first question, how do you know when your gut is healed? I don't know that it's possible to know with absolute certainty there, but the obvious things would be you eat and you digest your food well. You don't have gas and bloating after meals. You have regular, well-formed bowel movements with no undigested food, or very easy, no pain, no discomfort. You feel like you feel better after you eat rather than worse, I think is another. I mean, that can be related to blood sugar too, but that's a good sign that you're absorbing your nutrients. You're not losing weight. You're not gaining excess weight. And we then need to extend it to just overall health. Like if you have conditions that that are very often linked to poor gut health. Even if you don't have gut symptoms, you will probably need to do some testing to see what's happening with your gut, and then treat those things and then retest. I mean, that's something that I think is really important in functional medicine, is retesting to make sure that you've accomplished what you set out to accomplish. But if you've done all that and you don't have symptoms and the test results are clear, then I think you can reasonably assume that your gut is healed. And to your point, Peter, I've thought a lot about the definition of health. What is health? What is wellness? And if we define health as the absence of symptoms, or, feeling perfect in every moment, I think we're setting ourselves up for a lifetime of suffering because the reality is that very few people experience that. We are dying from the moment that we're born, which is maybe a depressing way to look at it, but it's the reality. None of us live forever, at least as far for now. And so the body will break down at some point. And the best we can do is to treat ourselves with, give ourselves the right inputs, the right food, the right physical activity, sleep, stress management, and do the best we can to maintain our health so that we can live a full and rich and happy life. And becoming super obsessed about, if we're 95% of the way there, then, and becoming, so focused on that last 5% to the point that we are ignoring our family, we're staying up late researching online about the latest, health fad. We're not having fun or, enjoying our life anymore because we've become so obsessed with this pursuit of this ideal of health. Then I think that can be really problematic, and it's actually not healthy. I think that person, I would argue, is less healthy than someone who even is at 70 or 80%, but is living a really full, rich, and rewarding life. So that's how I've come to understand it.
Yeah, I couldn't agree more. I sometimes define the health as the capacity to adapt to the external environment without being symptomatically in bed, right? Like without it being putting you on the floor. And there are grades. There are grades or variants of gray and white and black with all that. And I think we have to go into it with the understanding that life will never be perfect, and that ultimately we want to be happy and we want to feel fulfilled. But we don't want to be so hyper focused on every little nuance of a symptom that stress tends to degrade us even faster. So absolutely. And the body is a dynamic system. It's always changing. It's never the same from one moment to the next. So, I think we have to expand our definition of health, like you're saying, to include more than just what's happening physically in each moment. Yeah, absolutely. And have a realism about what to expect. Yeah. So, man, this has been a great conversation. I think we could probably talk for hours. I always enjoy it. It's really fun to chat with you, Peter. Yeah. Let's talk about I know your website. Can you just tell everybody who's listening what your website is? And we want to get them over there to sign up for your newsletter and get more of your information on a more regular basis. Sure. It's chriskresser.com is my main website. And then kresserinstitute.com is for healthcare practitioners. Okay. And again, your book, Unconventional Medicine, it's out. They can pick that up on Amazon. So those of you listening, chiming in, make sure you give us a thumbs up, give us a love or a flower or something like that in your feed. We want to make sure that you're giving Chris the propers, because he's taken his time out of his busy day. He's got a really busy clinical schedule, and he's taken time to be here with us today to help share that information. So let's just appreciate him and make it your round of applause, if you will. And also encourage you all to get out there and go buy a copy of Unconventional Medicine. Even if you are already a guru in this area, if you're a clinician or if you're a healthcare provider, go buy 5 copies and give it to friends. Let's get this information out there. Let's get this transformation of functional medicine. Let's convert it from a grassroots effort and let's make it go mainstream. And Chris, I'd just like to say thank you so much for being with us today and just sharing your knowledge and wisdom. I really appreciate you and all that you're doing.
Well, thank you, Peter, for everything that you've done and all the awareness that you've raised in this movement. We can't do it alone. You know, we all have to work together as practitioners and also through the public. I mean, that's where we're going to make the biggest difference, is coming together as a group. And, you know, there's a Margaret Mead quote that I really love. You know, I'll paraphrase it. It's never doubt that a small group of committed citizens can change the world. Indeed, that's the only way it ever has.
Yeah. Yeah. Love that. Love that. So any last words, parting wisdom, anything you want to leave the audience with?
Just want to empower everyone to make a difference here. I mean, even if it's just in your own family, you know, taking some of this information and using it to support the health of your family, or if it's, you know, mentioning something to your doctor or your nurse practitioner, or if it's maybe getting inspired and deciding that you want to join this movement and play a bigger role as a health coach, or even go back to school and become a practitioner. There is a role for you, whatever your background and goals are. You know, even if you've never spent a day in healthcare or have no science background, there's still a place for you. You know, that we can all play a role in this movement. So I just want to encourage everyone to consider that if they're passionate about this topic.
Fantastic. Fantastic. Well, again, thank you so much. And I look forward to bringing you back on in the future and picking your brain a little bit more.
You're welcome. Take care, Peter. Good to see you.
Bye-bye.